In 1966, I was working for the U.S. Department of Public Health here in San Francisco. One day, I was talking with some fellow workers, and somebody mentioned the Tuskegee study. And I asked about it, and he said, well, yes, he had heard of a man in the South, a black man who had been insane and gone into his private physician and been treated for syphilis. And later the private physician had been contacted and told that the man should not have been treated, that he was a participant, a voluntary participant in a human experiment on untreated syphilis.
I certainly think to have used human beings as guinea pigs, and I think that's what we have here.
Well, the autopsy evidence that we have available to us indicate that syphilis was definitely the cause of death in 7.
Considering the state of medical art at that time, there was a consensus that many patients did just as well without treatment as those who did have treatment.
I know that there were 2 patients that died, the doctor said, as a result of the treatment.
Initially, I was quite disturbed and frustrated because I had been trained to treat people with such a disease and then to see individuals who had the disease, and then these individuals being told that they weren't to take treatment. And obviously there was conflict between what I believed in and what these people were being permitted to do. That is, they were not permitted, rather, to take treatment. And they certainly were never advised to take treatment by the Public Health Service conducting that study.
The United States Public Health Service conducted a study beginning in 1932, which continues to this day, that involved deliberately withholding treatment from a group of 400 black men who were afflicted with syphilis. On September 8, 1968, Charlie Lee Pinkard, aged 59, died suffering from syphilis and was buried in this rural cemetery in Macon County, Alabama. He was one of 400 black men who were so-called volunteers in the Tuskegee study. Today, only 83 of the men are still alive. This man, Charles Pollard, is one of the survivors. Later in the broadcast, he will recount his experiences in this human experiment.
The government states that only 7 men in the experiment died as a direct result of syphilis. But now the Associated Press reports that the death toll may be as high as 100. Such publicity has finally resulted in state and federal action. Alabama's 2 U.S. senators have introduced a bill calling for compensation for the families of the deceased participants. The Alabama Attorney General is investigating a possible state violation, and the Department of Health, Education, and Welfare is investigating the study as well. Tonight, Black Journal will conduct its own inquiry.
These are some of the victims of syphilis. This is how it can disfigure. But that is only part of the story. If untreated, syphilis can lead to massive heart disease, insanity, and eventually to death. This is Tuskegee, Alabama, in rural Macon County, where it all began. Tuskegee is the home of Tuskegee Institute, one of the oldest black colleges in the nation, where Dr. George Washington Carver conducted his research. Macon County, with an 86% black population, is largely rural and very poor. In 1932, the U.S. Department of Public Health began a widespread syphilis treatment program in Macon County and in several other rural areas in the South. But in addition to treating thousands, the government decided to find out what would happen if the syphilis was allowed to develop uncontrolled by treatment for long periods of time. So they denied treatment to 400 black men in this experiment. Dr. Heller was directly involved in the study in 1933 and supervised it between 1943 and 1948.
As the best my memory serves me, which was 40 years ago, of course, the idea was to find a population with a heavy syphilis prevalence and incidence, and to study the course of syphilis in a population that was either untreated or relatively untreated. And it was found that in Tuskegee, Alabama, Macon County, that the incidence of syphilis was very high. As I recall it, something in the order of 50%. And I presume, I don't know, but I presume the Public Health Service planners decided that this was such a heavy incidence that this was a good place to have a study undertaken to find out what happens to people with syphilis who are untreated or relatively untreated. The idea was to derive information that could be applied to the citizenry or anyone who had syphilis, particularly the black citizenry in this instance.
Dr. Reginald James was a physician with the Alabama Public Health Service in Macon County in 1938, but was not directly involved with the study.
Now, of what value is this study? Well, it might give us a clue as to what happens to untreated syphilis. Well, so what? We knew all along from autopsies and from clinical observations of people who hadn't gotten treatment at the time they first got the disease, gotten treatment 2, 3, 4, 5, 10, or 20 years after getting the disease. We knew that all along.
Dr. Emerson Walden and Dr. Vernal Cave are board members of the National Medical Association, an all-black group of doctors dedicated to protecting the welfare of black people. The National Medical Association has issued the following list of demands. Dr. Walden.
The first was how many persons suffered death and physical or mental damage as a result of the project. Were the individual participants coerced or misled in any way? What provisions were made to ascertain that this disease was not transmitted by those infected? What care was given to children who may have been born of a parent suffering from syphilis? Has the department made any attempt to offer compensation or other forms of assistance to the remaining victims or survivors or victims of the experiment? Does existing law or regulation prohibit the type of human experimentation conducted? If so, will prosecutions of other types of disciplinary action be taken?
Mr. Pollard, a survivor of the study, remembers how it all began.
Well, back in 32, that's what they was going to do, have a medical clinic, and came through the country. Had us to meet at different places. At least, in other words, I met at Shiloh Baptist Church or schoolhouse, and we was going to take blood samples.
State Representative Fred Gray is attorney for Mr. Pollard and several other survivors of the study.
They thought they were participating generally in some sort of health clinic program. They were told that it was necessary that they have their blood tested, and many of them felt that they were being treated for some type of illness. They were not advised of what the illness was.
Well, they paid us $25 once after the 25 years. They give us, and then they give me a certificate. Several of us with our pictures on it.
Peter Buxton, a former employee of the U.S. Public Health Service, first broke the story to the Associated Press.
The people involved really were not volunteers. I had indicated that financial benefits and other medical benefits, treatment for diseases other than syphilis, had been offered these people, that burial fees had been paid or were being paid to those who were participating, and it also indicated that many of the men did not understand what the disease syphilis was and what it could do.
In 1932, doctors regularly treated syphilis with arsenic, mercury, and bismuth. Although the drugs involved some risk, they were considered the most effective treatment at that time. Why then did public health officials risk the lives of these 400 black Americans by deliberately withholding appropriate treatment? Dr. Heller gives his answer.
The treatment for early syphilis, and we must distinguish between early and late syphilis here. In early syphilis, it was treated with arsenic, bismuth, and mercury, all of which can be very, if not lethal, can be very dangerous to the individual if taken in too large doses. The treatment was not a good treatment overall, in the sense that you never knew whether the patient was sensitive to arsenic, for example, and bismuth and mercury were apt to have some deleterious effects on the patient. particularly if given in too large doses, so that there was a feeling among many physicians that people with syphilis probably did as well without treatment as they did with it. That was the feeling about the time the study started, as I recall it.
If the treatment was more dangerous than the disease, as Dr. Heller asserts, why was the government itself using that very treatment on thousands of clinic patients? In a report issued in 1936, co-authored by Dr. Heller, the Public Health Service stated that the arsenical treatment was adequate and should be used. Dr. James, who was treating syphilitics, confirms that arsenicals were the sound medical approach at that time.
It was a national accepted, matter of fact, you can say international accepted form of therapy, arsenic and bismuth. We didn't have the wonder drug penicillin at that time.
Nurse Rivers worked as a liaison between public health doctors and men in the study from 1932 to 1965.
If they had lived 4 years and up with syphilis, the chances are that they would live longer with syphilis than they would have without treatment. With treatment, this is the theory.
Do you think now that, in retrospect, that they might have been lying to you? Do you think the doctors might have been lying to you about it all?
I don't know. I haven't had any thoughts about it. I don't know. I don't think if they were, I don't believe that they were telling a tale to be, you know. I think personally, I think that this was something that they were sincere in themselves.
Disagreeing with both Dr. Heller and Nurse Rivers is Dr. Vernal Cave, Director of VD Control for the New York City Health Department.
The arsenicals were very effective. We must recognize, of course, that with many medications there are problems, and there were problems associated with the arsenicals. But back in those days, people did not withhold treatment for the benefit of the patient. Doctors at that time had enough confidence and faith in the arsenicals, a belief that they were helping rather than hurting their patients, to immediately move to the use of arsenicals if the diagnosis of syphilis is made.
Even if a participant in the experiment, after suffering ill effects from syphilis, wanted to see a doctor for treatment, there is a question whether medical services were available. Dr. John Millar is chief of the VD branch, U.S. Public Health Service, and presently supervises the Tuskegee study.
Well, as I understand it, the physicians who are actually involved in the study were not to treat patients for syphilis. What I understand from reading the paper is that the patients were supposed to have been told that if they wanted to be treated for their syphilis, they should ask for it, be treated, and then be taken out of the study.
Dr. James says he was told not to treat syphilitic patients participating in this study.
Well, any patient who came to me and I examined him and I thought he needed treatment, I routinely gave him treatment without any knowledge that he was in this particular study. But once I decided to treat him with the arsenicals or bismuth, then I was informed that this was a patient in the study, and don't treat that patient.
These men were never told that they could not go to any doctor. They were always, when doctors would leave them, they would tell them to see their family physicians. Nobody was ever told not to go to any family physician.
However, Mr. Pollard refutes Nurse Rivers' statement. He says he was prevented from going to a Birmingham hospital for a penicillin shot, along with other syphilitic patients who were not part of the study. He recalls that incident.
They got another blood sample of different people, and they went to Birmingham.
Where did they
They
go
went
there?
to the medical center in Birmingham.
And what did they go there for?
But they taking them penicillin shots up there to tell me I didn't go.
Were you supposed to go, or what?
Yeah, I was supposed to go, but Newz told me, said I couldn't go.
Did you ask her why?
No, I didn't ask her why, but I reckon she thought I had done had enough shots, and they wouldn't give me any more. You know, y'all booked to go, but she went and stopped it.
Mr. Pollard says he was turned away from treatment, and Dr. James says he wasn't able to treat patients in the study who requested it. Both assert that medical care was deliberately withheld, even when requested. Medical care for southern rural blacks in Macon County is shamefully inadequate, even today. But in 1932, there was only one black doctor for the entire county, and he was in the town of Tuskegee, inaccessible to the farmers living miles away. Most of them had never even seen a doctor in 1932. So the possibility of seeing a family physician was almost out of the question. Even today, poor rural blacks in Macon County rely on a mobile clinic which makes periodic visits into the area. Here it is set up several miles off the paved road in a clearing beside a black church. This OEO-sponsored mobile unit serves as a hospital, doctor's office, and drugstore for county residents. It is run by Dr. J.W. Williams. Dr. Williams was a young intern assigned to the Tuskegee study in 1932. He administered shots to the patients, but now feels he may have been giving them a substance that had no medical value. For many of these rural blacks, the visit to this clinic is made on foot and may involve a day's journey.
Another major question to be answered is whether any of the 400 men in the study could have infected their wives and possibly fathered children with congenital syphilis. Dr. Millar of the Public Health Service has said emphatically that this was impossible. All the men, he says, were in the latent stage of the disease and therefore couldn't infect others. But Dr. James disagrees.
These people are infectious depending upon the stage of the disease itself. The most infectious stage of syphilis is the primary stage, the very beginning, which they have an ulcer. The secondary stage, in which they have generally a dermatitis or certain sores, characteristic sores in the mouth. These too are very infectious. Now, these lesions of syphilis might disappear in a matter of months or weeks without any treatment whatsoever, but still the individual can carry the organism that causes syphilis for a period of 3 to 4 years, and this organism can be transmitted by sexual relations.
A 1936 Public Health Service article clearly states that at least 26 men in the study had their syphilis for 3 years.
Certainly, as stated in the article, the 26 whom they described as having the disease for 3 years or less, these individuals could have, there is a risk that these individuals were infectious.
The surviving patients in the Tuskegee study no longer bear these brutal marks of the disease. These lesions usually heal within 2 years. But is there any possibility of a relapse back into the infectious stage? Dr. Millar.
Not in terms of infectiousness. Now, there are clinical relapses that can occur throughout the duration of syphilis, but not into the infectious stage. Once you get past the secondary stage of syphilis, that's the end of the infectiveness.
From the reports that we have had an opportunity to look at, all of the patients used in this study had latent syphilis. Now, latent syphilis is not communicable while it remains latent. But a patient may be latent one day and be not latent the second day. He may develop relapsing secondaries, and this can occur up to 4 years after the original infection. This means that, and this may occur in up to 23% of cases. This means that there was a danger that these individuals could relapse. In the situation where they've relapsed with sexual intercourse, the disease can be transmitted to a sexual partner. A woman in the childbearing period now is infected. She can transmit this disease to an unborn child.
This child was born dead of syphilis. But even if the infant, infected with syphilis in the womb, survives birth, he faces at any time in his life the horrors of physical deformity, mental disease, blindness, and death. Even after penicillin was developed in 1943, It wasn't used in the study to treat the participants.
In those days, there was not enough penicillin. The Army and Navy, the armed forces, had almost a complete sole supply of penicillin. And another item was that physicians generally many did not believe that penicillin was effective in syphilis, particularly in latent syphilis, the type of syphilis we were dealing with in Tuskegee. They knew it was effective for early syphilis, but nobody had any real definitive knowledge of the results of treatment of latent syphilis or syphilis that had advanced to the various organs of the body.
Well, in 1943, Dr. John F. Mahoney startled the medical world by announcing that just a little bit of penicillin given over an 8-day period would cure early syphilis. Well, one does not have to know this for very long without knowing that once penicillin is widely available, then we must use it in the treatment of all stages of syphilis. Well, by 1946, penicillin was widely available, and the cost of it had been markedly reduced, and treatment schedules were put out by the United States Public Health Service dealing with all stages of syphilis, and they have modified those treatment schedules over the years. And they have been recommending and pushing for the treatment of syphilis at all stages.
In 1936, 4 years after the study began, the government concluded that untreated syphilitics had a greater death rate and suffered far more heart disease than did syphilitics who were treated. So the stated purpose of the study was already fulfilled after only 4 years. Yet the Public Health Service continued the experiment, thereby subjecting the men to further crippling effects of the disease. This has prompted charges that the study was immoral. Peter Buxton confronted the Public Health Service with this charge in 1966.
The response to the moral question was more or less, someone else has set this up. I'm here today. Unfortunately, it's part of my job. I wish the whole thing would go away. Nobody wanted to confront it directly because they knew it would be nationwide publicity. They knew that they would look bad. Nobody wanted to take the responsibility, and the buck just didn't stop anywhere.
But, you know, what physicians were told at that time, what the various people, community practicing physicians were told, who knows, I don't.
You must recall that I came into this study after it had been going a year. I'm not sure what they were advised initially.
We, the people who gave the drugs, that is the interns, made no decision. The patients who were to receive the medication were directed to us by the people in charge.
I mean, I am not worried about what they say that I was withholding the treatment, because I was not the doctor. I was a nurse. And nurses don't prescribe. I feel that knowing many of the things that, and because that I have done and helped in helping people and helping the folks in other ways, I have no feeling about that, because that was a doctor's responsibility.
The Tuskegee study was no secret. 15 articles have been issued by the government over the last 40 years. The first was actually presented to the American Medical Association's convention in 1936. Nevertheless, it was not until 1972 that an alert newspaper woman broke the story. Now, after 40 years, the government has launched an investigation. Dr. Vernal Cave is one of the 5 blacks on the 9-member investigating panel.
We will look into the Tuskegee situation in depth to find out what happened along the way, and we will be making recommendations, or observations or recommendations with regard to this. I understand also that we will be asked to look into the whole matter of human experimentation. You see, although this is a rather dramatic episode, and one which people can readily relate to and understand, human experimentation can be rather extensive. And we have to find out to what extent the disadvantaged, the non-white, the poor, the underprivileged, to what extent are they being used not as human beings, but as guinea pigs, and to look into what we have been doing and to come up with a program to see that those who are in relatively or absolutely helpless situations are not taken advantage of in order that we can so-called push back the frontiers of ignorance.
In addition to the medical controversy, the Tuskegee study points up a moral issue. Is human life too precious to be wasted in scientific experimentation? It also opens itself to the charge of racism. Would a responsible governmental agency ever conceive of an experiment on human life, using whites as guinea pigs? Is racism so deep-seated that black life has economic but not social value? That blacks are only useful when earning a profit, but valueless in making a significant contribution to society? Syphilis is a curable disease. But what about racism?